Welcome to Healthcare IT Today. I'm John Lynn, together with my colleague and friend, Colin Hung. The world of technology and healthcare are ever-changing in new and novel ways, and that's why we love this stuff. So join us as we discuss the latest healthcare and health IT news, meshed together in new ways, which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. On today's episode, we'll be discussing whether health IT is a contributor to or a solution for staff burnout. I don't know if that's a little fun talking about burnout, but be sure to follow the show on Twitter at the hashtag HITSM and our personal accounts at TechGuy and at Colin_Hung. Plus, check out our 15 years of health IT blog content at healthcareittoday.com. This is an important topic today. I think there's a lot of suffering out there, huh?
Yeah, there's quite a number of stories that came out, and what's precipitated this discussion of ours, John. I mean, there's been some reports recently about the number of nurses that are leaving the industry and quitting because they've just reached that breaking point. Now that we're sort of 12 to 18 months, depending how you look at it, into this COVID pandemic. And we're also reading a lot of stories around how it's not hitting all nurses equally. There's a disproportionate number of Black nurses and Filipino nurses that are dying and suffering more than their counterparts, and how the system may be failing them. So it's just, and nurses are the front line, right? We talk a lot about doctors, and they're important too, but certainly if the ranks of nurses gets thinned out, we were already suffering from a shortage. And, those are the people that, see the patients on a much more frequent basis than the physicians do. So, just not having enough of them is going to hamper our healthcare system for a long time. So definitely a very topical story.
Yeah, I was talking to a CIO today, and she is a physician, but now has become CMIO and CIO. And she said, yeah, it's great to have a physician perspective as CIO, but we really don't want every CIO to be a physician, because if we do that, we're taking a bunch of physicians from the workforce that we need, and we already have a physician shortage. And it's pretty funny, perspective, but it's true, right? This shortage of physicians is real in many areas, and I think with nurses, it's true as well. I know a guy whose entire business was around recruiting nurses to Las Vegas for years and years. That's all he focused on, because Vegas had a hard time getting nurses to come here. Granted, we don't have a great education system and all these things. I think we've improved it, but and so that's been a problem before. And now I think many of them are looking at it and saying, man, why am I working all these long hours and in these risky conditions in some cases? And I think of a story of a doctor I was talking to. It's like, we were willing to go in there without the proper PPE. We didn't want to. We knew it was the wrong thing to do, but we also knew that our patients would suffer if we didn't. And so, they were willing to go in and sacrifice, many of them, to do that, but we shouldn't put them in that position. That's a scary position to be in.
Yeah, for sure. And I think, reading some of these articles by other outlets that were kind of investigating this, right? A lot of what people were saying, the ones who did leave, they were saying, look, at the beginning of the pandemic, it was that sort of all for one for all kind of, mentality. And certainly even the public, with the banging of pots and the delivering of food, and, they were really helping, right? And they felt supported, not just by their organization, but also by the public. But since the pandemic has dragged on so long, we've seen that support wane across everything. So the public is not as invested, in supporting the front line. I think we're very sympathetic, but there's certainly not the same level of support, right? Same thing internally at the organizations. We've now kind of got to the point where, yes, there are some programs in place, but lunches aren't being delivered anymore, right? The extra pay isn't there anymore, and those kinds of things. And so it's worn people down. And unfortunately, because we still haven't got vaccines and a lot of really effective therapeutics yet, a lot of the people who are in ICUs, unfortunately, are not going to make it. And so how much of that can one person really take, right? Like, that's a lot to put on anybody who works in healthcare, to see day in and day out patients that you really can't do much to help. So that was what was quoted in a lot of those articles as, a reason where they just reached that breaking point, and they have left the industry.
Yeah, it's chilling to think about. I think of my cousin, and this was a separate issue. He was a counselor to child abuse, to children that were abused, and at some point he just said, I can't hear another story, right? And I think we're suffering from some of the same, right? I can't see another person die. It's got to be the mantra or the experience of uh, people that are doing it. And I could hear some people out there, I'll say it very facetiously. Well, we sent two, frontline healthcare workers to the Super Bowl, two from each state. That didn't, it's like, yeah, I think some people unfortunately kind of look at it that way, and they don't realize that so many on the front line are still battling and dealing with the trauma, both seeing what's happening in the hospital to COVID people and the trauma in their own life where they had to be away from their family, they had to sleep in the garage, they had to do this process of changing clothes in the garage and showering before any sort of interaction. I mean, that has long lasting impacts that we're going to probably feel for years.
For sure. And, to not to pile on too much, but, what was one of the more disturbing statistics that came out in some recent findings by the nursing associations, I'll pick out one of them. So 30% of the deaths that have happened in the nursing ranks, 1/3 have been Filipino. Yet
Wow.
Filipino nurses only make up 4% of all nurses in the
Hmm.
United States. So you look at that and go, that's really out of proportion.
Hmm.
They don't even know they don't even know why. Like they just realized, and I won't say they just realized this now, but they just had the finding, and now they're trying to dig into it, and they're realizing they don't have really good data to figure out why. It is
Yeah.
part of one thought was, is it because Filipino nurses tend to be more working in the ICUs versus not? They don't know that, so they have to now go back and take a look
Sure.
at it. Is it because they don't, they live in multi-generational families? They have a multi-generational home, right? Which is sort of more typical for people who just immigrated here, right? Like, all these are factors. And so you talk about burnout not only at the job, but then they're also going back home into situations where we know there are high risk factors, right? So, but just looking at that and going, well, we've never talked about the plight of Filipino nurses, right? That's not a headline news, right?
No, never seen that
No,
headline.
there's no rally, but you look at that and go, that is a problem. And the thing is that they've noticed it, right? So they've talked to, in this article from CNN, they interviewed a lot of the Filipino nurses, and yeah, we've known this for a while. Like, because we see the names of the
Mm,
obituaries that come out, and you can see the names by the last name. We kind of know that this is a person of Filipino background, that another nurse has died, and
wow.
it's anyway. So it's, I guess the good news is coming forward now. The bad news is that this has been happening for a year, and it kind of flew right under a lot of people's radars that they were burning a lot of our nurses and our clinicians out.
Well, and just to throw a little health IT angle in there, like imagine you're going through this process of, this crisis, these challenging situations. Do you have enough PPE? All of those things. And then you have to go in and document a lengthy note to justify some reimbursement requirement. I can only imagine the mindset there, right? Or you're on the front lines doing the vaccination, doing the COVID testing, and of course your scheduling system doesn't work, and so all these patients are showing up angry in front of you saying your patient scheduling system told me this, and health IT is contributing to that burnout there as well. So I think those are some of the challenges with health IT, and that we can help to solve. It's implementing it properly, like just getting the scheduling system or the communication system together with your marketing team, so the patients actually know what to expect when they get to the clinic. Whether it's for COVID vaccination, which I think is by now should be a process that everyone understands and we can communicate effectively, but also, how do I digitally check in, and what should be my expectation? Can I wait in the waiting room? Can I not? All of these things that make a patient anxious. And if the patient's anxious, they're going to do that on the staff. And that wears on the staff as well. So those are some of the areas I look at and say, yeah, health IT has definitely contributed to burnout, between both how effective is the process of communicating with patients and creating a great experience for these new workflows we have to do, but also, oh great, I get to document some more. Like, yeah, that's tough.
Yeah, I definitely think you're right. I don't think health IT in any way is the cause of burnout, but it's certainly a cause or a contributing factor to, the mounting levels of frustration. And it's the little things that add up over time. Like I even look, you mentioned some really big ones there, John, about scheduling and the patient relationship. And when it's not done well, you have an irate patient or an anxious patient showing up, and that has a cascading effect on the people working at the hospital. I would even look at things like alarm fatigue, right? Like the
Mm.
number of devices that we now have inside a patient's room, and all of them beeping and notifying, and maybe it's notifying the nursing station when something's sort of out of whack and they have to run in and check it. And, we're asking them to do a lot more stuff because we can. Like we have the technology now to do all of this.
Are we in
But
a permanent emergency too? Like, you know,
exactly. But that's where I'm exactly going. Like, imagine the poor nurse, right? They have like 19 different infusion pumps they have to remember how to use and operate. And then they, and then it's all beeping back at the main station, right? And then they're trying to cover each other's shifts because they're trying to, they don't have enough people. So just the amount of technology that they're also expected to just use, not even just to document, but just to physically use, has
yeah.
exponentially grown over the years. So you're asking this poor person, has gone through, schooling to be a nurse. Now it has to basically go to tech school to learn how to operate some of these devices.
Yeah.
That is also a contributor of the burnout in my mind.
Yeah, I heard an interesting example from a CIO who talked about moving remotely. And they're like, normally when we'd roll out, a remote desktop setup with the VPN access, we'd kind of walk them through and kind of handhold them the way through the technology implementation. But they're like, in COVID, we didn't have that choice. We basically had to say, hey, we're going to throw this to you and we'll support you as best you can. You can call us, but you kind of got to do it on your own. And credit all those healthcare workers, they did, right? I mean, they figured it out. And but that has another cost of doing it. Telehealth is the same. Sure, they put up with it initially because they didn't have a choice,
Right.
but at this point your telehealth workflow should be improved. If it's not, you're responsible for that burnout.
Absolutely. Hey, listen, if you're just tuning in, you're listening to Healthcare IT Today with John Lynn and Colin Hung. We want to take a minute to recognize two members of the community who are working really hard on this problem of burnout. The first is Gabe Charbonneau. You've probably seen his awesome Fight Burnout t-shirts that recognize burnout warriors. And John and I are both wearing them right now. They are awesome. Gabe has been working hard for a number of years now to improve the doctor-patient relationship so that more doctors stay in the industry. To learn more and get your t-shirt, go to fightburnout.org.
And also, we want to give a shout out to Janae Sharp and the Sharp Index. They're doing some really great work. Having suffered the tragedy of physician suicide in her life, the Sharp Index is working to reduce stigma around physician suicide and burnout, and really, more importantly, how to improve physician wellness. If you want to learn more about what they're doing and support their efforts, check it out at sharpindex.org.
So, John, we've been talking a little bit about sort of the burnout side, right? And how, everything that's happening there for nurses and docs. And then, of course, how health IT contributes to that burnout. But maybe let's flip it around a little bit and talk about can and how does health IT help avoid burnout or reduce it?
Yeah, well, I think the problem here is the commonly said phrase that right now it's not evenly distributed.
Right.
And so, I mean, just use something as simple as an EHR. If you look at the satisfaction scores, which I think is related to burnout, class has done a lot of research on this. If you check out their Arch Collaborative, and it shows the same software implemented in the same type of environments, i.e., size of organization, get dramatically different results. So, I think it can, if it's implemented properly, help a person feel satisfied with what they have to do and even avoid some of the burnout that an EHR could cause. So I think that's one example. Although the most exciting thing that's happening, and we're just starting to see this come into fruition, and that's my favorite topic, ambient clinical voice, or some call it ambient clinical intelligence. That area is the reason it's so exciting is because it could address this problem, that i.e. doctors do not want to spend time documenting for reimbursement for regulation. I mean, it's obvious. You and I don't like documenting anything we have to document in our jobs either, right? Like, it's just the nature of it. But ambient clinical voice could help assist in that and essentially automate the documentation for the doctor. So that's an area to me that's like, bring it as quickly as you can because it truly does solve the problem that we're talking about of burnout with the doctors.
Yeah, that's a great example, John. Where my mind goes to in terms of how health IT can help avoid burnout. I mean, sort of the grassroots one, which is, well, I think they should just ask, right? Like, if you're working in a health IT department at a hospital or at a clinic, or if you're a vendor, just ask your client, like, what is it that's most frustrating about our solution, and how can we make it better, right? How can we eliminate a step? How can we make the screen simpler? And really ask them for their opinion, right? And incorporate it. That's sort of a very easy way to address it, because let's be honest, like, everything can be improved,
Absolutely.
but how often have we actually gone back and actually sat with the clinicians that are using our systems and asked them the question of, okay, if you had to, what should be our highest priority here? I mean, we all think it's this because it's on our list, but what's your list? And I bet you'd be surprised as to some of the very simple things that they're going to be asking for. So to me, that's one way definitely us as an industry can help with burnout. But the one technology that has me excited, and it's been around for a while, and we've written about it recently as well, is of course telemental health services.
Mm, yeah.
We know we have a shortage in that area, but this is probably one of the best use cases for telehealth, right? Is you being able to sit down and talk to a mental health or a behavioral health specialist, or to talk to someone, even a peer group, right, that's going through the same thing. This is now all very possible and very accepted way to get this type of care. And now you're able to make this available to a larger audience, right? Whereas before you're limited by geography, right? Typically these services would be in urban areas. But
Yep.
now with this technology in telehealth, you can offer it to many more places, smaller organizations, large organizations, and so forth. And in fact, that is what's happening with a lot of the with the Black Nurses Association. They've put together some telehealth that's available now to nurses around the country, and the same thing with the Filipino Nurses Association. Like, they're doing some things now where it's support groups. So I'm excited about that aspect of health IT helping with the burnout.
Yeah, I love the idea of shadowing them to understand what their burnout really is. I had it happen one time with a nurse practitioner I was working with, and I showed her a new feature, or a feature she didn't know about was what it really was. She's like, "Oh, how come you didn't show me this before? I didn't know that was possible." And I was like, "Oh, we've had it for like 3 years," and I felt bad, right? Like, I felt like a failure in some respects. Like, I didn't show this to you before. So, there's a lot of value, and often a programmer who shadows will look at it and say, "Oh, that's an easy fix. Why didn't we just do that?" So I love that. Although it was interesting when you said just ask. I was actually thinking about that from a very different perspective. And that was, have you asked how much burnout there is? And our friend, Dr. Charbonneau, Gabe, who did the Fight Burnout t-shirts, he actually records daily his burnout. In fact, I think it might be multiple times a day. And he often will share it on Twitter if you want to go check it out. But he shares how he's doing burnout wise so that he can understand how he's doing personally. And even with the work I do with Care Cognetics, one of their customers is actually basically surveying their employees every day to understand how their mental health state is, to understand how they're doing. So that's another way, going back to what you said, just ask. But I think many organizations are afraid because they say, if we ask, we're going to discover the problems, and then what? And I think that's okay. Like, it's okay to just say, hey, we have a problem and we're not sure how to fix it. And the fix isn't another yoga class or or a weight room, or a free lunch, right? Like, that's just too simplistic. Like, but at least understanding the problem and showing that you care to actually know that there is a problem is probably the first step.
Yeah, I remember having a coworker of mine. Yeah, I was saying that I borrowed from him, which I love. Problems don't get better with age, right? Like this
Mm.
problem is there, right? The sooner you're able to put the spotlight on it, the better off it is because even if you don't have the solution for it, at least then you can get attention on it and more minds getting applied to it. And all of a sudden, you're not the only one, looking at the problem trying to fix it, which I think is the worry of most executives are like, yeah, if we find this out, like, "What? I don't know how to fix it." Well, let's just first make sure that the problem is there and how deeply it is felt. Because I think most of the time you'll find that it's affecting more people than you think it is. And there'll be more people willing to help out if you just highlighted it. So,
Well, and I think even asking the question, now you have a benchmark for all the other efforts you're doing. I mean, if you have that benchmark and then you do the yoga class, you'll realize it's not as effective as you think, probably, right? So, I mean, I think that's where it's good too, is then you have some benchmarks to evaluate your progress. But, going back to the health IT side of things, there are so many opportunities to automate the things that we're doing. And I know many in healthcare have been afraid of that word automation. And in many industries, they've been afraid of automation because that often means worker replacement. In healthcare, we haven't seen that to be the case. At least I haven't really seen it, with very few exceptions. Automation usually just takes away the repetitive tasks that people hate. The stuff that's burning them out. So all of the automations that we can implement to actually make the stuff that people hate as in their job, those things are welcome and actually will help to contribute to helping people not feel burnt out.
no, I'm totally with you there, John. You know, I think the healthcare situation is a bit unique in the sense of we have a shortage. We cannot find enough nurses. Now, again, it's not equally distributed, right? I'm pretty sure it's, in some of the some of the urban centers, it's not as hard to find a nurse or find a clinician or and anything like that. But that's and then the rural areas, it's a bit harder. But we're suffering from this already. So any automation means that, okay, like now instead of asking my nurse to do a double or a 1.5 shift, I can just give her or him or her a regular shift, right? And that would be a big improvement. Like if I do nothing else to say, okay, you don't have to actually work those 3 extra hours. You can go home, you can have dinner with your family. That is going to be an improvement. So I'm totally with you there that let's look at automation a bit more seriously and get rid of the stuff that people don't want to be doing or that's repetitive, where you don't need a human being right now. And then let them focus on the 20 million other things that are going to be added to their plate when that space opens up, right?
Yeah, there's plenty to work on in healthcare. There's no doubt about that. But I think the other challenge we face now is that COVID has kind of made burnout a universal problem. Like, I think if we did a survey of people, I guess there's maybe a few introverts that are like, hey, this is heaven. I don't know. I guess there might be a few out there, but I think most of us are suffering from burnout of some form or fashion, right? And my fear though is that, are we going to use that as a reason to not address like systemic burnout that happens in healthcare and to a lot of people? And I don't know, it's a tough situation because we're all feeling the effects of COVID to one degree or another.
Yeah, I actually think it might be the opposite, John. I think because we're all living through our own forms of burnout, whether
Mhm.
that's Zoom burnout, whether that is, home office burnout, work from home burnout, we're all experiencing a big disruption to our lives. And we're all, for those of us that are in lockdown, the repetition of it, the day in and the day out of it. And so for me, I think there's more empathy for burnout, right? Whereas I think it was an other person problem before,
Mm,
right? Like
yeah.
because I don't work in a job where I felt burnt out, but now I feel it. Like, and I certainly don't want to compare my burnout to like what the nurses are experiencing, the doctors are experiencing. It's not really a comparison, but I think I have a little bit more empathy now because now I can feel like, oh wow, like this is not a great feeling. And I can only imagine what it's like when you have that much more pressure on you to in this kind of situation. So I'd like to think that, with COVID, there's been more awareness and more empathy caused by the fact that we're all experiencing a form of these kinds of emotions, like this burnout emotion.
Yeah, absolutely. I mean, virtual third grade is my burnout, so I'm all for. It's yeah, you're right though. I mean, the empathy that we can have is very different because we've all been through something this year, and so I think that's an opportunity for us to show each other some empathy, and to, and sometimes that's all it takes for burnout, right, is just to show, yeah, this sucks. Like, it's not so much necessarily that you even have to do anything. And there are things you should do, and especially healthcare organizations, that they can do, but acknowledging the problem is a big impact for those that are suffering from burnout. I know it's true for me when I'm suffering from it, and hearing someone else say it, it's like, oh, it relieves the burden, at least some.
Well, and I think that to me, that's one of the biggest benefits that may come out of this, right? Is certainly the tension on it has been great, but for me, it's the lessening or the decreasing of the stigma. Like, it wasn't that long ago that we were talking, when we would look at people funny if they were telling us that they had a mental health issue, right? Or that they were suffering from burnout. We look at them funny, go, suck it up, right? Like, or like, what are you talking about? Like, life is great. And so people wouldn't bring it forward. There wasn't an understanding. But I think now, like, we hear it and see it in our friends, who will now openly go, man, I'm not having a good day, right? And
Yeah.
today was terrible. I need to cut off at 5 today, guys. I'm sorry. And you know what? I think people understand that now, right? Well, I
Yeah.
think, especially managers, if you're hearing that from one of your employees now, I think there's a much higher degree of understanding than prior to COVID,
Yeah.
right?
Well, and I think there's stigma around, if I'm burnout, I can't work. Whereas I'm burnt out, I just need some recognition. Maybe I need, I need a moment to, to find my bearings, right? And there was certainly a lot of stigma around, hey, you're a doctor or you're a nurse, you're highly educated, you have a very well-paid job, suck it up, right? Like,
Right.
you're not homeless on the street. And there's certainly a balance that needs to be found there. But you're right, now that we've all felt some of it, we can have a little more empathy, regardless of the fact that, hey, we are blessed, but we can still be burnt out.
Absolutely. And John, we could probably go on for another hour talking about this topic. It is so important. And thank you. Thank you for to all of you who've tuned in to this episode of Healthcare IT Today. You can find out more details about our show by checking out the programs page on healthcarenowradio.com. And please share your voice and engage with the community on Twitter using the hashtag HITSM or at the website healthcareIT.com. I'm Colin Hung, my friend and health IT collaborator, John Lynn. Thanks for listening.